Hi, my name is Ian McCall, and this is just a little talk on a man with pigmented lesion on his forehead. You can see the variation in pigmentation that was occurring here. This was back in 2009. Let's have a look. This was the dermatoscopy at that time. Again, you can see this was the relevant area. Most of this though looked like a solar lentigo, but this could have been an early lentigo maligna. 1 year later, by the way, he's aged 94. 1 year later he came back, and this was the clinical picture, a little bit more extensive here, but with a darker area here. And when you look at the dermatoscopy now, this area is filled in, and you can see a sort of blue-white veil threatening to occur here as well. So at this point in time, he should have had something done. He didn't want anything done. The idea was that we were going to review him. He was supposed to come back in 6 months' time, and he didn't. Now, the next time we in fact saw him was in 2013, so about 3 years later. And when he came in at that stage, this was what had happened to the dark area. It had become obviously a lot darker. This area here seemed to have changed a little bit, perhaps a little bit of regression or the like was occurring in here as well. So you can see the way this has progressed between that 2010 and the 2013. This was the latest dermatoscopy, virtually a structureless blue. So if you're looking at that, this is how it's changed from this in 2010 to this in 2013. So let's have a little look at the histopathology. This is the cause of the blue nodules that we're seeing. They're these atypical melanocytes, large clump of them down here in the dermis. You have this area here though, which has some melanophages in it, and there's collagen. This is where there's been, I think, a little bit of sclerosis, a little bit of regression, in fact, occurring. But you can see the changes occurring in the overlying epidermis here in the basal layer with these abnormal melanocyte and abnormal melanocytic proliferation. And it's a sort of lentiginous proliferation here. There's not a lot of nests that you're in fact seeing. These are the melanophages. There's a little bit of a lymphocytic infiltrate out there. Now, if we look down at the base of this, we're looking to see if there's any maturation of this. And I don't think there is any. Let's just have a close look. Okay, this is at the top of that clump of cells. Note the variation in the size of the nuclei here. The pathologist who reported this said that there were about 12 mitoses per square millimeter. I always find it difficult to sort of show mitosis, but you can see here there's no great maturation of these, and there's a broad spreading edge here. In a nevus, the cells would dissipate out as small strands, but here there's a broad advancing edge to this tumor. So this in fact was a superficial spreading melanoma with a nodular component with some regression. This was 1.6 millimeters in depth, and the fact that there were quite a lot of mitoses was obviously a worrying factor. This again is just to look up at the overlying epidermal layer here. Some cells going up to the upper levels of the epidermis. But if we can just follow this along, perhaps follow it right along to the edge of the large shave that was done, you can see again this proliferation of atypical melanocytes all the way along the basal layer here. Again, a little bit of regression, a bit of melanin and melanophages. And as we work our way along, we can see that there's still proliferation of these cells, although they're getting less and less as we get out towards the edge. If you had just done a punch biopsy up here, you wouldn't really have picked up anything other than the melanin melanophages and the bit of solar elastosis underneath here. There's the more marked solar elastosis further down. Again, as we work our way to the edge here, just the solar elastosis underneath here, the bit of regression. Some, I'm not sure if these are melanocytes or excess melanin and keratinocytes. And then we come to the edge here. Now, if we were to look at the other edge of this large shave, let's see what it shows. Here we go. You can see quite a marked allogenous proliferation there. Lots of cells, some little nests, small little nests here, big variation in the size and shape of these cells. A few little nests there. But it's extending all the way along. Here we go here. Thinning of the epidermis, abnormal cells all the way along here. And as we get towards the edge here, still some abnormal cells here. So, this edge is still involved as well, as you would expect from the area that was in fact shaved. So as I say, a 1.6 millimeter thick melanoma has developed in A. lentigo maligna over a period of 3 years. So this man's now 98. And I think we are going to have to excise this, put margins on this, but it's still going to leave some of the surrounding lentigo maligna. I don't think there's much we can do to avoid that. That's going to, if all of that's coming off, it's going to require a rather large graft to cover this. So we'll see this gentleman back, but it's a reflection that if you see these lesions early on, you should treat them early on. This has been left. He wasn't followed up when he should have been followed up. And he's developed a 1.6 millimeter thick aggressive melanoma with, as I say, quite a few mitoses and very little in the way of lymphocytic infiltrate here. So these aren't good prognostic signs. He's got no local glands that we could feel at the moment, but that's not to say that metastatic spread there isn't going to occur, or may in fact have already occurred. Thank you very much.